So welcome, my name's Jenny and my co-presenter today is Jennifer. And we're members of the 988 Planning Committee. So thank you all for joining us to learn about New Hampshire's 988 phone, text, and chat services. We should be able to cover all this information within 20 minutes or so. And so we're really set up to have time to take your questions at the end and to really hear your feedback. And we want to give you the opportunity to help us in planning by talking through this session with us at the end.
So throughout this webinar and this conversation, we are going to be discussing some topics that might bring up some big feelings. And so at any time during the webinar, if you start to feel overwhelmed or would like to connect with someone, we do have a resource room available. The resource room is staffed with peer support workers who are happy to support you, just if you're having a difficult time, or if you want to share information about a personal experience that you think could help us with the planning for these changes. The link to this room is in the chat, and you're welcome to visit that room if you'd like to talk to someone about how you're feeling. And so we hope that that works for everyone. So we'll jump right in.
So the 988 Planning Committee has several upcoming sessions on this topic, and some sessions may better answer your questions or meet your needs. So for this reason, we just want to make everyone aware of the other opportunities to join in and to learn about 988 and give your input. So the session today is really meant for the general public, and the sessions are to help with the planning for 988 in New Hampshire. So 988 is not active now, and it will be available in July of 2022. And this is really to make sure people are aware of the changes and again, to help with your feedback to help in the planning process.
So you might be wondering, and it's probably why you're here, why do New Hampshire residents need another phone number? Don't we already have 911 and 211? And of course, yes, we have those numbers in New Hampshire and they're doing everything that they should be doing. However, we have learned over the years that some of us experience urgent needs that 911 and 211 are less able to help with. And so you all know to call 911 when you have a fire, when you need medical help, or when you need the police. However, there are other times when you or your family could need additional support. And so 988 is a number that you can call, text, or online chat with when life seems like too much for you or for someone you know to manage. Trained staff can help you there to help you things with like worry, sadness, anger, alcohol or other drug use, feeling overwhelmed, and much, much more.
So 988 is a mental health and substance use and suicide prevention help center. And they answer the phone, text, calls, and online chat. And the words mental health describe how well someone's feeling inside and how healthy their thoughts are for them and their loved ones. And sometimes we have thoughts and feelings that are healthy. We feel good, we feel loved, we feel supported, and our thoughts are positive and they help us make good decisions. But we all go through times when our thoughts and feelings are painful and when we're worried that we might make decisions that aren't good for us and the people around us. So throughout this presentation, we'll use the words mental health and substance use and suicidality. And so before we go further in the presentation, we just want to show you what we mean when we use these words.
Perfect. So mental health includes all of our thoughts and feelings, the good and the bad. And so for this presentation, our focus will be on the difficult thoughts and feelings we might be experiencing from time to time. And so these might be things like hopelessness, feeling overwhelmed, worrying, being really tired or stressed out. You might be fearful of the future or wishing altogether that you weren't born, or you simply don't know how to get through the day. Sometimes people describe this as my heart hurts or experiencing overwhelming emotional distress.
So substance use means the use of alcohol, tobacco, or other drugs. And substance misuse, the way that we use this term, could look like using medication that's not prescribed to you or using more than the amount that's prescribed to you, drinking too much, or having difficulty stopping use even when things aren't going well because of your use. So sometimes people use substances to help them manage or cope. And substance use disorder or addiction is compulsive use despite negative consequences. Substance use disorder is a chronic illness like asthma or hypertension, and treatment is available.
Suicide. So suicidal thoughts and feelings mean wishing that you weren't alive anymore, or feeling like you can't find a way to go on living. Hurting yourself or thinking about hurting yourself is a sign of emotional distress. And these feelings can go stronger if a person doesn't learn other ways to cope with their pain. And so finding other ways to cope that work for you can make you healthier and stronger. And just as a point of clarity, suicide death means causing injury of oneself with the intent to die.
So it's important for everyone to know that all of these experiences are reasons you might want to call or chat with 988. And we understand that life can be hard and that we all need help at some point. So 988 is one of the ways that we can ask for support and help. Being connected to family and community support and having easy access to healthcare can all decrease these difficult thoughts and situations. And you never need to worry alone. And you should know that people who have these same feelings go on to get well, and you can too.
So who can use it? Who is 988 for? Anyone, really. It's not limited to caregivers, parents, children and youth, other family members, friends. You yourself, of course, can use it. Your neighbors, your teachers and your school staff, coworkers, really anyone.
So you might be asking why you would call, text, or chat with 988. And the answer is quite simply because you or someone you know needs help managing at this time. So you don't need to have a diagnosis or be experiencing a crisis to call, text, or chat. You may also be asking, can I call or text or chat at any time of day and night? And the answer is yes. You can call 24 hours a day, 7 days a week, 365 days a year.
So you could be wondering, okay, this is all well and good, but what's actually going to happen when I call? So if you call, chat, or text 988, we're going to describe the experience that you will likely have. So when you do call, or when a family member calls, or someone in the community calls on someone's behalf, they'll reach 988 by phone, chat, or text, and they'll be promptly connected to and answered by a qualified, non-judgmental crisis worker. So this person will listen to you and understand how your problem is affecting you, provide support, and get you the help that you need. The goal of any conversation is to get you to a calm, safe place. Sometimes that means providing you with a referral to get more help, and sometimes it just means being there and listening. If you're thinking about killing yourself, the crisis worker will help you create a plan to stay safe. If you're not able to get to a calm, safe place via phone, chat, or text, a mobile team can be sent to your location. A mobile team is a licensed clinician and a peer support worker. A peer support worker is someone who is in their own mental health recovery journey.
And so if you do need help in person, a licensed clinician and peer support worker will be connected to you to introduce themselves and tell you when they will arrive. And you can continue to talk with them and let them know any additional information that you would like. And their continued goal will be to help you to get to a calm, safe place. Once they're in person, they'll continue to work with you to meet your needs and to determine whether any other emergency services are needed. Just to be clear, 98% of the time, calls like this do not require first responder services. If other emergency services are needed, the crisis worker will remain with you on the phone or in person until those services arrive. And if a mobile crisis team helped you in person, then they will be the people that also follow up with you within 48 hours. And in the cases where a mobile crisis team is not deployed, the call center will follow up with you within 48 hours.
So you may be wondering about privacy and confidentiality. And so we absolutely understand that you have a right to privacy and protection under state and federal laws. 988 does not violate any of those privacy rights. We know that talking about personal problems, especially with a stranger, can be challenging. And so when you call, chat, or text 988, you'll talk to someone who will help you. You can remain anonymous during this conversation. You don't have to share your name or anything identifying about you. If you do need someone to come in person to help you more, you can meet at a neutral location like a community center or a park or a school or a Dunkin' Donuts. And any information that you share will be kept at the highest level of confidentiality, just like other health records.
We all need help sometimes. And here in New Hampshire, we really understand it's okay to ask. So asking for help is, when you need it, is really a sign of strength, and you're not alone.
Okay, so can we do it now? Can we already call? No. So we're helping to plan for the launch of this service on July 16th, 2022. And that's when you'll be able to call, chat, and text with 988. And if needed, someone can come to help you in person. Until then, you should continue to call the Suicide Prevention Lifeline number at 1-800-273-8255.
So really, this is a planning session again, and really we're here to get your input. So there are ways you can help in the planning of 988. The State Planning Committee is looking for your feedback tonight, and with these additional planned listening sessions. So we'd really like to open up the session to questions and answers. And we're also going to launch a survey so that you can take a few minutes to sort of let us know what resonated with you, what barriers you see, what questions you have, and how can we reach your community with this message. So please complete the survey so that we can learn more about how to help in New Hampshire and how to make sure everyone hears about the changes and the services. We'll also share out the survey via email.
And a copy of these slides and the recorded presentation will be emailed to all of the registered participants. And so we're going to go ahead and open the survey now. And while it's open, we will take a look at the chat. I saw that some of you were submitting some questions and looking through there. So we will formulate some answers, but give you a few seconds to answer the survey.